So let's talk about the signs of melanoma. The presentation of melanoma can vary depending upon the subtype. The ABCDEs of melanoma is an acronym that can help you detect melanoma. So let's put that acronym onto this diagram. So A stands for asymmetry. When we look at a mole, if the mole is asymmetrical, that means that if we were to fold it on its vertical or horizontal axis, it would not match on all sides. The B in the acronym stands for border. An irregular border means that the out edges of the mole are not uniform. They can be indented, they can be notched, but they're not smooth and rounded. C stands for color, which means that there can be an irregularity in the color of the mole. And D stands for diameter, which means that the mole is typically larger than a pencil eraser head size. And then E was added to the acronym to really help us educate our patients and even ourselves that even though moles can look normal one day, another day they can look irregular or they can evolve. There can be evolution of the mole. Some of the other signs and symptoms to look for when trying to determine if a mole could be melanoma or if you could have melanoma would be itching or other skin sensations like tenderness or pain, sores on the skin that do not heal, a bleeding mole or even oozing from the mole. Change in the surface of the mole can be a warning sign. The mole can start to appear more raised or more like a bump. And then, of course, an extension of the discoloration or an enlargement of the discoloration. Redness or swelling around the mole can also be a warning sign. And then keep in mind that melanomas, although they can occur anywhere on the skin, in Black people, the most common form of melanoma, the acrolentiginous melanoma, tends to occur in areas that don't see sun exposure. That means they can occur in areas such as the groin, the palms of the hands, the soles of the feet, and even under the nails. So when we see melanomas or when we're suspicious that we may see a melanoma, the first thing that we as dermatologists do is we consider a biopsy. A biopsy is a way to remove skin tissue to determine a diagnosis. Prior to actually doing the procedure, the dermatologist will numb up the skin. And once the skin is numb, we'll remove an area of skin in one of three ways. We can do what's called a shave biopsy, which means that we are basically removing skin from the surface of the skin. Or we can do what's called a punch biopsy, where we take a cookie cutter type instrument and we push it into the skin in order to remove an area of skin for biopsy. An excisional biopsy means we're just taking basically a larger portion of skin, typically an area that goes beyond the margin of the area or growth of concern. Once we complete the biopsy, if we've done a punch biopsy or an excisional biopsy, we're going to put stitches into the area to close the opening, and you will likely come back to have those stitches removed in about 7 to 10 days after the procedure. You will go home with instructions on how to take care of that site. And when you come back to have your stitches removed, you will most likely have received your diagnosis.